I think we've seen from recent trials and recently approved targeted therapies for thyroid cancer that these drugs actually do improve progression-free survival. And so, we're now learning how to select patients who would benefit from targeted therapy. One of the things with the targeted therapy is the side effects that come with these medications. Clinicians need to be aware and need to be carefully monitoring these patients on a regular basis. One of the things I'm trying to study now is the effects of targeted therapy on body composition. If you look at some of the phase 3 trials of these different drugs, you will find about 45 to 50% of patients have weight loss in the first year of therapy of these drugs. I did a review of some of the patients that we've treated with these medications at MD Anderson and found up to 70% of patients actually lost weight in the first 3 to 6 months. And so it's become an area of interest for me because I think weight loss leads to dose reductions, leads to treatment interruption, and this down the road may have an effect on progression, on tolerance of the medications and therefore progression of disease. And so what I'm trying to do right now is look at what the effect of these medications are on both skeletal muscle and adipose tissue. They have androgenic effects that may affect fat or adipose tissue. They also affect certain pathways, PI3 kinase pathway, that may cause muscle atrophy. And so these are areas that I think we need to look at potentially so that we can intervene early and select patients who may benefit from either nutritional support or exercise to help them prevent both skeletal muscle and adipose tissue loss, and therefore enable them to tolerate the drugs better without multiple interruptions in therapy.